Yes, we do have a new CEO, but first I'd like to say I'm wearing a suit today because we have a family celebration which reminds me of the importance of looking after ourselves and family, not only our patients but ourselves and our family as well. So yes, we have a new CEO. His name is Dr. Lance Emerson, PhD. Lance comes from a background of both professional organisations, the Pharmaceutical Society, the Pharmacy Guild of Australia, which is a very effective advocacy group, as well as an extensive senior public service role in the Victorian Public Service. His PhD is in health services, particularly around information, and he has a very strong data background. The way Lance was selected was that ANZCA engaged with a professional search organisation or company, and then who provided a long list, and then a committee of myself, Tanya Selleck, the Vice President, Dilip Kapoor, the Dean of the Faculty, supported by Brett O'Meara, who is the Head of HR and Finance. We then brought that down to a short list, and then we interviewed 4 people, and the selection panel included the others I mentioned. Added to that was Leona Wilson, the Executive Director of Professional Affairs, and one of our college lawyers, so that we had a balanced group with broad geographic representation, including Leona representing our New Zealand colleagues and Dilip representing the faculty. Lance was the unanimous preferred candidate by the panel, and we're very pleased that he's accepted our offer to him to become the next ANZCA CEO, to follow on from the work of Nigel Fidgen, who's retiring at the end of this year. We should all see perioperative medicine as an opportunity. I'm a bit concerned that some may see it as a threat. The value lies in expanding the potential roles for anaesthetists and others, but for anaesthetists, and the example I use, whilst all anaesthetists are perioperative medicine practitioners, the perioperative medicine program allows those who choose, probably about 20% of fellows, to move into a broader range of more health service type activities. The example I use is very close to my own heart, having type 1 diabetes, is that a perioperative medicine practitioner is an expert in the managing of the individual person with diabetes, such as me. However, a perioperative medicine specialist is someone who's done further training in perioperative medicine, understands health systems and how you would introduce a diabetes program within hospital care within your hospital. So I think it is a chance for fellows who choose to move into more systems type work to do so, very much supporting the many who will say their preferred work is within the operating room, because I think my own personal experience working in a hospital that has a very strong perioperative medicine unit is the chance to be fully informed about often very complex patients. The other component of this is also with government, particularly the Australian government, and their demands for generalism. I also think perioperative medicine is something that will be valuable to those who really want to work in regional centres as well. So as the college progresses with our work in perioperative medicine, I'll hope it will be seen really as an opportunity for those who choose to take part, recognising that many fellows will choose to have the broad range of anaesthesia skills that you learn in your ANZCA, but there are other added opportunities as well. The issue around how we communicate has been brought to the surface again. The keyboard warriors have been in action on a couple of topics, and if we consider the way that I think it is really important that we communicate to have a positive culture within ANZCA, but also in our broader fellowship, is that we are civil, that is we're polite, that we use knowledge, that is we know what we're talking about, and we have empathy, that is we can walk in the shoes of others. And I think that has fallen by the wayside. I'd also say it's really important that we consider people by their actions rather than their appearance.